Hello everyone and welcome to Oral Surgery Notes and Mind Maps by the Medi Study Co. My name is Dr. Sumit Shinde. I am a maxillofacial and head and neck surgeon, and the topic for today is Champy's lines of osteosynthesis. So, if you want to understand the Champy's lines of osteosynthesis, first you need to understand what are the forces acting on the mandible. And if you want to understand what are the forces acting on the mandible, this is the most important diagram. Look at this. So, consider this over here to be a fracture line. Alright, so on this fracture line, there are forces which are acting. Look at this. The forces which are first acting are from the muscles of mastication. Alright, the temporalis attaches itself on the coronoid and pulls the mandible superiorly. Masseter attaches itself on the lateral part of the ramus, pulls it superiorly. Medial pterygoid attaches itself on the medial part of the ramus and pulls it superiorly. So the proximal compartment of the mandible mostly has been pulled superiorly. Let's talk about the distal compartment right over here. The distal compartment has attachments of anterior belly of digastric, which pulls it posteriorly and inferiorly. It has attachment of the geniohyoid, which pulls the mandible posteriorly and inferiorly. So if you calculate the cumulative force over here, proximal part of the mandible is being pulled in this direction and the distal part is being pulled in this direction. Okay, so if you talk about the effects of the mandible right over here, what do you get? You get the mandible going apart from each other at the superior fractured fragment. That becomes the area of tension, and similarly at this border the fractured fragments come close to each other, and that is why it is called a zone of compression. Alright, so there are these three forces acting, and of course anteriorly in the midline compartment the mandible moves along in this direction, separated at the midline, and these forces, they are called the torsional forces. Alright, so these are the forces acting on the mandible. One is from the muscles of mastication, one is from the occlusion. Now if you have understood what are the forces acting on the mandible, let me tell you why did these Champy's lines come into existence. Okay, so in the older times, the hardware that used to be used was very bulky, very strong hardware. Okay, this hardware was called rigid fixation of the mandible. Okay, so what were the properties of these hardwares? These hardwares, they used to take away, they used to absorb all the forces from the muscles of mastication, and they used to absorb all the forces from the occlusal compartment. So now do you understand? A plate which is used to fix up a fracture, and that plate takes away the forces of occlusion and the forces from muscles of mastication. But try to understand one thing now. Okay, let's for a second consider that this fractured site that you see over here, this fractured site has a brain of its own, and let's call this brain functional matrix. So now a signal which arises from the functional matrix of the mandible sends a signal to the actual brain that okay, we were fractured, but a maxillofacial surgeon came and put up a very strong plate over here which is counteracting the forces from muscles of mastication as well as the occlusion. So we don't need any extra bone for any extra strength over here. Whatever extra bone you have sent for our help, you can take it back. So what does the brain do? The brain interprets that signal that okay, there is already a plate here which is taking up forces from muscles of mastication, which is taking up occlusal forces. So I don't think that extra calcium is needed over here anywhere. So rather the brain will send that extra calcium somewhere else. And that is exactly how the brain resorbs that extra calcium away from the mandible and causes a bone resorption. This bone resorption secondary to rigid plating is called stress shielding effect. So the scientists very soon they realized that when they started putting these rigid plates, there was an unconventional bone resorption happening around these areas, and that is when they realized that okay, we should make the plates which take away only the forces from muscles of mastication. The mandible or the fractured mandible It requires the forces from occlusion, because see, your occlusion and your masticatory forces, they are your functional matrix. Okay, the occlusion tells the brain that okay, the bone is well and alive, please give us more calcium. That is exactly what the conversation between brain and the mandible that happens. Okay, so simplifying it even further, the mandible and the occlusal forces, they are its functional matrix. All right, yeah, so sorry. So coming back to the core topic that we have over here, what are the Champy's lines and why did they come into existence? So the scientists decided that all right, we don't want these bulky plates, we'll make something more simpler. So these were mini plates that they invented. All right. So when these mini plates were invented, they had to find a position to place these mini plates. And what position did they find? Look at these. These are your Champy's lines of osteosynthesis. Alright, now look at these lines. Champy's line over here in the body of the mandible is a single line that is at the subapical area between the apices of the tooth and over the nerve over here. Okay, when these Champy's lines, they extend to the angle part, they are divided into two, that is the superior and the inferior Champy's line. Okay, superior Champy's line goes towards the internal oblique ridge, and the inferior or the lateral Champy's line, it goes towards the external oblique ridge. And anteriorly, you're supposed to place a plate along the subapical area, number 1, and number 2 along the inferior border of the mandible. This is where you are supposed to place these mini plates. And what exactly would happen? These mini plates, they are only strong enough to take away the forces from muscles of mastication. They are not strong enough to take away the forces from occlusion. So what exactly happens whenever you place a mini plate to counter the forces of occlusion? You have to place something that holds the occlusion together. What would that be? Absolutely right. They are arch bars or IV loops or any kind of dental wiring. This is exactly what you need to counteract the forces of tension, and this is exactly why you need Champy's lines of osteosynthesis. Every little detail that I told you guys about the Champy's lines of osteosynthesis is beautifully given here on the mind maps by Medi Study Go. Alright, all the Champy's principles are right here for you guys. The Champy's theory, which I told you, where the tensional, compressional, and the torsional forces act, it's right over here. Ideal lines of osteosynthesis, alright, it's right over here summarized for you guys. Okay, and now my part as a surgeon, when it comes into play, I would like to show you guys some of my operated cases where I would like to show you. Now look at this. This part over here, this picture that you see, this is a strong recon plate. The thickness of this plate is 2.7 to 3.2 millimeters. Now such a thick plate, look at this. This plate does not need a tension band. This plate does not need arch bars. It is more than capable. It is more than capable of taking away all the forces from muscles of mastication as well as the occlusal forces. This is what a recon plate looks like. Coming back, look at this. Anterior Champy's zones, let me show you what it looks like. If you see, look at this. Now, this is the inferior border of the mandible that you see over here. One strong plate is placed at the inferior border of the mandible. Two smaller plates are placed at the subapical area. Okay, look at this. This is the Champy's line, inferior aspect. This is the Champy's line's superior aspect, as you can see. All right, and now when you see this, this is how a body of the mandible is plated. All right, look at this. This is the Champy's line over here. Now the Champy's line will pass at the subapical area. This is the mental nerve that you see over here. It has been carefully preserved, and this is the body of the mandible where you see the plate has been plated along the Champy's lines of osteosynthesis in the body fracture. And again, last but not the least, This is an angle fracture. I'll tell you why I so confidently say that this is an angle fracture. Look at this. This is the 6, this is the 7, this is the 8. So a fracture line which passes between 7 and 8 over here, and the plating is done. It is a 2.5 mm strong plate which has been placed on the external oblique ridge. That is the internal oblique ridge which I just marked with an eye, and this is the external oblique ridge and the ascending ramus. And the plate which we have placed over here is according to the Champy's laws. Thank you very much for attending this lecture, and there's much more to come for you guys. Thank you.